You are watching this video because you were diagnosed with high blood pressure prior to pregnancy, called chronic hypertension, or you were diagnosed with high blood pressure related to pregnancy, called gestational hypertension or preeclampsia. This is an educational video to provide you with information for when you are discharged home from the hospital. What to look out for when you are discharged home. We recommend you check your blood pressure once per day. It's important to rest for 15 minutes before you check your blood pressure. You want to be in the sitting position with your arm at the level of your heart. Look at the picture for a reference. Record your blood pressure on paper, or often patients find it's easiest to record it in their cell phone. If the systolic blood pressure, the top number, is 160 or higher, or if the diastolic pressure, the bottom number, is 110 or higher, please remain seated at rest and repeat your blood pressure in 15 minutes. If your blood pressure stays this elevated, please call labor and delivery, 202-877-8879, or proceed to triage. We want to know if you develop any of the following symptoms: headaches that are new and do not get better with Tylenol, spots in your vision, right-sided pain, nausea, vomiting, chest pain, or shortness of breath. If you continue to have elevated blood pressure and the symptoms listed above, please call labor and delivery. We may recommend you come to triage for evaluation. Please bring a copy of your home blood pressures with you. In triage, we will check your blood pressure and send blood work. For those that are already on a blood pressure medication, we may just need to make some adjustments. If you are not on any medication, at this time we may decide to start you on a blood pressure medicine. Sometimes we may need to start a medication called magnesium sulfate if we believe you are at risk of seizures. This medication requires you to stay in the hospital. We like to see everyone with hypertension back in the office within 10 days. Depending on the severity of high blood pressure, some patients may be asked to come back to the office as soon as 3 days after they are discharged home. This appointment is for a blood pressure check. It's very important we keep a close eye on your blood pressure. You may need to be seen again in 1 to 2 weeks if changes are made to your medications. It's also important to come to the office for your 6-week postpartum appointment. Usually, within a few weeks after delivery, your blood pressure will improve. For those patients who are on a blood pressure medication, oftentimes it can be discontinued a few weeks after delivery. This is usually determined at the 6-week visit. However, some patients may need to be continued on their medications. High blood pressure places you at risk for heart disease later in life. It's important to see a primary care doctor within 3 months of delivery. It's also important to focus on healthy eating and exercise. Here are some helpful tips to stay healthy. You can start with light exercise, such as walking or yoga. Please check with your doctor before you begin high-intensity exercise or weightlifting. Focus on whole fruits, a variety of vegetables, lean protein, such as chicken, whole grains, such as brown rice or quinoa, and dairy, such as low-fat milk or yogurt. There is a website you can go to review examples of what to eat. If you're interested, please visit choosemyplate.gov. From there, you can make your own My Plate plan. They have a section for breastfeeding moms. It's important when you make these types of changes to get the whole family involved. This can be a stressful time having a newborn and recovering from your delivery. It's important for you to take care of yourself. You may not have time to go to yoga, but if you're interested in meditation and have a smartphone, download the application Simple Habit. You can listen to these sessions from the comfort of your home. They also have a meditation station for kids. Check it out if you have older kids you think this may be helpful for. High blood pressure can affect future pregnancies. If you're thinking about another pregnancy in the future, please see the OBGYN early in your next pregnancy. Thank you for delivering at MedStar Washington Hospital Center. You and your baby are our priority. I hope this video was helpful. Thank you.